local governments are an important interface between the public and communities. What are some of the best practices that you can share with other local governments playing this important role in the face of a crisis?
Well, as a country, most of the activities are largely centralized within the central government, which is in charge of spearheading this campaign and the struggle against COVID. And there is a national task force that was put in place. And as local governments and as state leader, we are playing a subservient role to this particular cause. There are certain functions that were delegated to us, which we're emphasizing. But the general picture in the country is that the cases we are dealing with right now are largely imported. We have registered very, very few cases from the community, and our central focus and attention right now is on preventive measures to ensure that we curb the spread of this scourge. And we had to spot the areas where there are black spots, there are those risk areas which were blacklisted, and largely those are the entry points to the country, the airports, the border points, and so on and so forth. So that's where most of the emphasis is being put. And Kampala has no international airport. Kampala is not on the border with any of the neighboring countries. We are largely dealing with the communities internally. And the measures we have undertaken are basically about sensitization of the masses, about the dangers of COVID. We have aggressively gone out to alert the population, and I think we have registered a huge mileage. People have appreciated the dangers, and they are very, very cautious, and emphasizing World Health Organization standards like social distancing, hygiene, masking, and so on and so forth. We are putting much emphasis on that because we have direct interface and connection with the people, and also putting in place emergency response measures to deal with any emergency that comes up. A 24-hour call center, and of course a rapid response unit to deal with any case that has been identified by our surveillance team, and also the network, the ambulance system in place, so that there are responses that can be made immediately we get a case spotted anywhere. So ours basically is now to getting prepared to deal with those cases which come up, in addition to sensitizing the masses about the dangers of this and taking precautionary measures, and also dealing with the attendant problems, of course, the challenges of survival, because we are just emerging out of a lockdown. There is partial easing up now, coming up, emerging, but people were hard hit by the vagaries associated with the lockdown, given the nature of our economy, which is basically tailored on hand-to-mouth survival. It's an informal sector-led economy here in Kampala, and we are trying to make those interventions to ensure that people survive during hard times, distributing relief food as one of those measures, and also calling upon and appealing to the Good Samaritans to intervene and see, because we do not have well-established food security systems in the country, social security systems, and we don't have food silos. Neither do we have those stopgap measures that can be undertaken. So what we are relying on are largely, the support we get from the communities, those who can lend a hand here and there. So we are trying to improvise. You have to appreciate this is a global pandemic that caught us off guard, just like it is the case with many states, including developed countries. So we are trying to improvise here and there, doing our best possible, yes.
Excellent, great. I think I'm a huge fan of especially your website. I think the city of Kampala has done a really great job in terms of communicating about the pandemic and about the virus. So I must commend you on that.
Thank you. My pleasure.
Great. So in terms of, informality is something that cities all over Africa are dealing with. You mentioned the Good Samaritans that are working with those that can't afford to feed themselves day to day. Anything else? How the city of Kampala is dealing with informality in this crisis?
I must admit it's a huge challenge we are dealing with because the settlements are informal, the business interactions and formations are also informal. So largely this informality has posed a very, very serious challenge on how to deal with the whole complex situation compared to a structured society. So we are trying as much as possible to reach out to this informal settlement using our own teams. For example, when it comes to distributing the equipments we are using, our village health committees, we have tried to create those village health committees to help us reach out to those informal settlements in the slums because they know better how to deal with those communities there. They live with them on a daily basis. They can speak the language they understand. They can easily interact with them. But these are people who have gotten the basic training on how to guard themselves against these dangers. So we are putting much emphasis on village health committees. Challenges on how to facilitate them because we are operating on a very limited budget. But if we had capacity, and we are pushing the central government to fund this infrastructure, this arrangement, this program of using the village health committees to help us reach out to the informal settlements. That's the best way we can do it. And of course, the communication network is equally limited. Very few people are connected to the social media. Not many have those gadgets. Even the mainstream media, people may not afford to listen to all the programs. So we want to use this mechanism of the outreach mechanism using village health committees to go on this kind of, to carry on with this activity of sensitization and informing, basically equipping our people with what they need to do, including, by the way, on their improving their diet, because we want people to boost their immunity. That is a critical element. Because COVID having no cure, apparently, we have to devise mechanism of ensuring that people feed well, live on a balanced diet, and they can fend for themselves. They can build body immunity. They can cushion themselves against that attack. So that counseling, that guidance is quite important. And we're also using our health network within the city to reach out to the people. Basically, that's what we're emphasizing.
Great, excellent. I mean, one other thing is that, you know, in terms of these crises, it really does test us in terms of bringing out emergency forces and making sure that we keep our communities safe. As you know, Africa is also going to be and has already been quite hard hit by issues such as climate change.
Yes, sure.
What are some of the key lessons you can share with other cities in terms of building resilience and a sustainable city?
Well, quite a lot we need to do, cities in Sub-Saharan Africa, to enhance and boost our resilience in terms of equipping our people with the necessary tools. I've emphasized the issue of communication is quite important, because these communities which have no access to high-tech information and who are largely detached from the rest of the world, it's our duty to keep on pumping this information so that it's well received. The best tool we need right now to build this resilience is information. We need to find ways and means. And in our country here, like the city of Kampala, unlike our neighbors, Kenya, Tanzania and others, we do not have a common language. You know, here we have not even developed a national language. So we have so many. It's not like in the Western world, you reach in Paris, many can speak French, you reach in New York, they can speak English. Here it is a hodgepodge of different languages. So communication is a very, very big problem. And I think it's not unique to Kampala, a couple of other cities. So we need to devise ways and means of ensuring that people get to understand this message in their local languages, which are varied in nature. And that is very, very important, because without adequate information, it's difficult to build the resilience you require. At a continental level, we need to strengthen the platforms we have. The Covenant of Mayors is quite important. It's actually, this is a huge eye-opener to us that we are a global family, we are one family, and we have to develop universal values as members of the Covenant members of this covenant. We need to understand that what happens in Kigali, what happens in Bamako, what happens in Pretoria is pretty much the same thing which is happening here in Kampala, and we have a common front on how to deal with them. Where I fall short in terms of requirement, I have a fallback position in terms of ideas, in terms of any support there is, because a problem happening in Kampala right now. For example, if I have a case of a COVID positive person, if there are no measures to stop international travels, in the morning, that case can be transferred within 4 hours from Kampala to Pretoria. We need to appreciate that. So that is the kind of situation we should deal with. This business of pushing ourselves in different enclaves and think that we are cushioning ourselves, we don't care about what happens elsewhere, I think we should think out of the box. It's quite important. So we need to strengthen these networks, the Covenant for Mayors, and I would seek for the widening of the mandate. The scope of the Covenant of the Mayors in Sub-Saharan Africa is, yes, we are dealing with climate change, but these issues are interrelated. The issue of this pandemic has got a lot of bearing on climate change. So we need to focus on these new emerging challenges as a Covenant of Mayors in this particular region, and also have some sub-regional groups, blocks for ease of communication, like the one for East Africa, because right now East Africa is very loose, very loose. You may be having a Kampala which is completely detached from Nairobi, but look at what is happening between the borders, Uganda and Kenya. It's quite terrible. It's really awful. You can see actually the biggest crisis right now we are facing between Uganda and Kampala and Kenya. It's at the border. It's the situation there is now horrible at the border. Actually, that is now one of the black spots we have in Uganda. So how do we use these covenants? Rather these international platforms, these regional blocks to deal with those challenges? I think we need to point a lot of, we need to come up with lots of ideas to move into that direction of strengthening these platforms.
Yeah, absolutely. I couldn't agree more. One thing that the Covenant of Mayors can do is provide a platform for subnational governments around Sub-Saharan Africa to connect. But I think your idea of having sort of regional platforms for connecting is an interesting one.
Yeah, sure.
Hopefully this webinar series will go some way in terms of connecting subnational governments to each other, providing a platform for them to discuss issues virtually.
Wonderful.
Obviously, we are, it's not a tried and tested thing yet in Africa. There are some issues around connectivity, around accessibility for some people, but hopefully we'll work through those issues. So maybe just as a final question, is there a message of solidarity that you would like to share with other colleagues around Sub-Saharan Africa as we all make our way to deal with this crisis?
Well, I think one big lesson we learned from this world pandemic is that we are all vulnerable. We are all not safe. Issues of racism, xenophobia should be discarded. This thinking that you see, for me, I belong to a relatively better city compared to these ones. For us, this shouldn't invade our economy and so on and so forth. This pandemic has equalized all of us. So it should bring us together as a humanity. So as a message of solidarity, we need to go back into some soul searching and say, yes, ultimately, at the end of the day, we are one person. We are one people, regardless of our color, creed, religion, and all those things that divide us. So we look at ourselves as one person and deal with challenges from that particular perspective. So where there are good practices, we share them. It's quite important. Sharing good practices. What has worked in Cape Town, probably they work here, and so on and so forth. So we need to build those synergy, we need to build those connections and see how best we can build the resilience together. In other words, the resilience of a particular city depends so much on the resilience of your neighbor. So if your neighbor is vulnerable, you are not safe as well. So we should support one another to build a common resilience. Otherwise, this pandemic has taught us a very, very big lesson. And we should we should fail to take the signals at our own peril.
A very powerful intervention there from our Lord Mayor of Kampala. And I think more than ever, we are all united on the continent. And there's a great sense of solidarity between all of us here on the African continent. I see a question has come in the Q&A. And I would just like to offer this question to our Honorable Ms. Namazi from Uganda. The question is, the question goes, thank you for the commendable efforts done in Uganda, especially societal safety nets for the vulnerable in communities, such as the disabled. My question is, considering that there are floods and locusts which were experienced, what measures are you putting in place to address those challenges, remaining focused on the pandemic? What have been challenges and lessons learned? Ms. Namazi, over to you.
Yes, yeah. Can you hear me?
Perfectly.
Yes, thank you very much. First of all, I bring warm greetings from the Lord Mayor of Kampala. Sorry, he's not feeling well, so he could not make it today. So I'll stand in for him. Well, I also want to thank all the African cities, the African leaders that have really come up to fight this global pandemic that really it has showed us that we need to build a common resilience as cities without ignoring any of us. Yes, as Uganda, we have really done a lot to fight the pandemic, but in the middle of the pandemic, many things have come up. Locusts, yes, I want to thank the person that has raised the question. The locusts came in, I think, beginning of the year, and they came from Kenya, a neighboring country. So they came and joined Uganda. They came in to Uganda, and they have affected us very, very much. In the midst of the pandemic, where we are telling people not to gather, where we are telling people to stay at home, the locusts came in, and this was so bad because they started eating their crops, and there were issues of hunger. People were not going to work because we are telling them to stay at home. We need to fight the pandemic. So these locusts, they have affected the national budget because government has been forced to spend much more money that it had not budgeted for. The budget for disaster preparedness was really not as big as expected. So they had to ask for a supplementary to make sure that at least they can cater for this. They can fight the locusts that are in place. But we had challenges of capacity. because you find that our neighboring country Kenya they were using planes to spray the locusts to make sure that they kill them. But you find that here in Uganda we did not have because it was a disaster. We had not prepared for it. We had to bring in the we had to bring in what we were using to spread the locusts, and that had to take some time. So as the locusts were busy eating people's crops, we were waiting for what we have. We were waiting for the drugs to use all the way from China, so that we can go and spray these locusts. And in the meantime, they were eating. So we had that challenge, and it has affected people very much. But I want to thank God. I want to thank the Ugandans that they have decided to stay calm in all this. And as I can say now, the locusts have been managed. You don't have any more locusts as a nation as of now, unless they come in the future date. Then the issue of floods. There we have some of our friends that they are staying in Kasese, in the western part of the country. We always, these people always face floods, and we have lost lives. People have died, and as a leader, it has been so bad. It has been so dehumanizing to some of these people. They have lost their crops, and we are in the midst of bad. And this is showing us as a nation that we need to increase our budget for disaster preparedness, because at this time people don't have where to stay. They don't have where to stay because as a nation we have so many emergencies to attend to. We are concentrating so much on COVID-19, and we are somehow ignoring some of these other things, like the pandemic, like the locusts. We are ignoring things like floods. So people are there, they are stuck at home, they are stuck, they don't know, they are in camps, they are in refugee camps, they don't have relief items, and we have to depend on people who are donating, because as a country our budget is not as big. So right now, when we are budgeting, as we pass our national budget for 2020-2021, we must make sure that at least we can concentrate on certain areas, especially areas of public health. We must concentrate on areas of disaster preparedness, and also prepare our people and also prepare and also invest a lot in some of our staff to build their efficiency, especially the meteorologists who can be able to probably read the weather, and also the meteorologists who can also know that maybe we may expect floods at a certain time T. So as a nation, we have really learned a lot. We have faced very many challenges in the midst of this all COVID-19, and there's a lot to learn, and there's a lot to do. Yes. Thank you, Tara.
Great, thank you so much, Ms. Namazi. I couldn't agree more with you. You know, this, especially as we face more and more the devastating impacts of climate change. I think, you know, all of our cities here in Africa, we really need to be building the resilience of our cities. The issue of having enough budgets as a city, but also as national government, to prepare for disasters is becoming more and more apparent. But, you know, hopefully as we move forward, we'll see that issues such as disaster risk management are not only siloed into particular departments within a city, but they actually run across all departments. And it is key to make sure that we're prepared with the funding to fund all of those issues. Thank you so much.
City, it is the floods. The floods are not only in the western part, but we also have floods. We have a problem of rising water levels here in the city of Kampala, and there are markets, there are people staying around there, and their businesses are gone. Children are getting sick of malaria. Some of them are even dying in the houses as they are sleeping at night, because water comes into their houses at night. And as a city, we do not have a budget for relief. we find that we have to depend on the national budget. We have to depend on the money that was allocated to disaster preparedness. Yet, as a city, we also should have budgeted for disaster preparedness. Our people in the city are suffering. They are facing all this. We want to relocate them from the lake shores, but we don't have where to take them. We don't even have the capacity. We just have to tell them, maybe you have to look for some of your relatives. You have to go to the village, and they cannot move because public transport is under lockdown. It is only going to be starting to work on Thursday because of COVID-19. So there's all these situations. The budgeting issue is so important that we cannot afford to ignore as African cities. Yes, as African cities. Thank you.
Thank you very much. Very powerful
No problem.
intervention. Thank you. Great, so now we will move on to the intervention by our second speaker. Our second speaker is the Honorable Mayor Jefferson Koichi from Monrovia in Liberia. And Liberia, as most of you will know, has also been very hard hit in the past by a number of other crises. So some of the points that the mayor is able to make is in terms of learning from past crises, dealing with the Ebola virus, but also how their experience has been with dealing with COVID-19 and also any lessons that they've learned there.
Local governments, as you know, are at the forefront of global changes. And so we wanted to ask, what are some of the best practices that you can share with other cities, with other local governments, playing this important role in the face of a crisis?
Well, thank you. Thank you ever so much. Basically for us here, what we quickly adopted was a community-based engagement and consultation. As you may be aware, this is a virus that it was completely very astonishing to global leaders, community leaders. So the first thing we thought to do was to engage with community leaders, and so that we can be able to consult with them and bring them on board, so that together we can be able to find a solution. And what did we learn when we engaged them? What we learned when we were able to we established an effective formal social network with a speedy sharing of vital information. We were able to get that. It also promote and easy acceptance of new practices. When you engage in those are key things we were able to get. And to inform them about the significance of mask wearing. And it also helped us to write a house support and a good way of volunteers. We also created a relocation of the market. We were able to fumigate those markets. But all these things happen, basically the baseline is about community engagement. With that engagement, we also got to realize that their own participation was also important. And how we were able to recruit close to 8,500 participant community dwellers. You may be aware, Monrovia population is close to 1.7 million person. So it's almost 29% of the population of our country. And out of that 1.7 million, we have about 400,000 who currently do it into slum community. That also make our environment, our city a threat because of the condition they were faced with. So the 8,000, we're able to talk to civil society grouping, the youth and student, community leaders. We have 6,000 active case founder and 2,500 community leaders, where you have the commissioners, the governors. We're able to bring them on a particular umbrella. On the basis of that, we were able to begin an effective and a more cohesive fight against the COVID-19.
Wow. Well, thank you, Lord Mayor. What are some of the key lessons then that you can share with other cities in terms of building a resilient and sustainable city?
Well, what I can say to other cities, the first thing in terms of Crises, we got to realize in Monrovia that people remain our greatest assets. People remain our greatest assets, and that we also have another challenge, a lack of adequate technology that hamper an effective response and preparedness for any crisis at all levels. That's another lesson we learned. They also have community leaders who are vital to every quick impact health crisis. So, like, take for example, the 6,000 case funnel, active case funnel we engaged, the young people we engaged, what we thought to do was that we went to the community, we engaged community dwellers, those kids that reside, because our anticipation was that this is a very strange disease, a virus. We didn't want to have a community resistance. And so we needed entry into the community. How do you, it looked very strange that people just enter the community, people fear stigmatization. And because we also have an Ebola experience here where community resisted fearlessly. So we thought the easy way to break through that, we wanted people who are familiar. So we wanted familiar faces, people who can articulate the message. The messengers might be people that I knew. So getting them helped to ease our challenges and possible or potential community resistance. So that was a very key. So we said people now become an access to our engagement against the COVID-19. There was another challenge. If we have what you call a data or a technology, we could not have gone in the community to begin to ask how many households, how many dead person, how many sick person, because like I said to you, bulk of those people reside in slum community, they cannot afford. So we needed people to visit those homes literally. So people went house to house, begin to count people and say, how many persons have visited you? So it was a serious challenge for us. Then another one that we were, community leaders were very instrumental because we were able to convince them, we were able to use them and pass those messages on to them so that we can be able to collectively as a country, particularly as a city, so we can be victorious in these troubling and difficult moment of our country.
This year, we've seen how an unprecedented crisis can rapidly change the local and global situation and force cities to find new and innovative solutions. So how can cities prepare for future challenges?
Well, I do agree with you, and I think the way we intend to use the Monrovia perspective, well, first to create a sustained network for elect at all levels in the city. You create a sustained network for all elect in the city. You employed effective service delivery system, service delivery system. You encourage a new business endeavors that are service-oriented, utilize innovative technologies that support service delivery, for example, waste collection. So, for example, waste collection. So I think when those methods are being put into place, it helps you as a policy maker or as a global leader. It helps you to be on the line when something occurred that, like you rightly place it, unprecedented, so we can be able to engage. So, like for example, one of the lessons that I learned from them, we were here on this engagement, we were able to create a call center. Even though we have people, we created a call center now that I think as a mayor, we need to sustain the call center, because the call center, even though we have people on the street, we have people in the community, people were engaging, engaging individual, but we still had a hotline where people could be able to reach. We have the young people deployed in the call center. The call center were there to collect, because people were getting afraid. The measures, you do not touch people. Day battles was being found on the street, and people were getting sick. People were panicking. So people were trying to alert us. And once we get alerted, then we contact the medical practitioner. Then we move into the community. When there is a body in the community, we go there and collect the body. We preserve. When people die under normal circumstances, we'll be able to get. So we'll be able to engage in. And we could not forget about a routine health service. We're very concerned about routine health services, because we thought that people had other, illness and diseases that got to do nothing with COVID-19. So our thing in the center, we're also concerned about them. Who is looking after them? How can they be separated from this, from this deadly pandemic? So the call center became very effective to us to sustain our routine, our routine health services, where we're in touch with the medical practitioners.
Thank you, Mayor. And on a similar note, in fact, what is the value then that you see for a local government network, such as the Covenant of Mayors of Sub-Saharan Africa, during a global crisis like this?
Well, basically, what I would like to share at this point is that the network can be a good platform of exchange of approach and what you call direction. Like you see, like what I'm doing now, I'm trying to share my own perspective. I will be so glad. I want to know what is happening in South Africa. I also want to know what is happening in other countries. Apparently, there could be some uniqueness. Apparently, there could be lessons that we can be able to share that could also help me to work in a more effective way when I'm faced with this kind of circumstances or condition. Another one is that you have a network can be a forum for mutual support, like I just explained to you. A network can become an avenue for knowledge exchange. So I think with that, something that we can consider, I think it will be extremely necessary.
And I'm sure that there are many other cities here as well that could learn from your experience too, Lord Mayor. Are there any final words?
I want to say thank you so much. And I think the Covenant of Mayor, I think we have a challenge. We need to be more robust in our engagement. And I think what you see now, we understand this unprecedented virus clearly show that mayors as the front line and the leaders that can take, because we are the first response of our people. And around here, take for example, in central government, like my city became the epicenter. My city has been densely populated, and our central government look up to me in terms of becoming the first response. And in fact, the whole entire COVID-19, it began with me, and we were leading the drive. I'm just trying to tell you the significant about mayors in our respective cities. So globally, when we see the significant about a mayoral rule, and we have the Covenant of Mayor, it just also tells me that we need to be more robust. We have a very cardinal role to play. We need to be more supportive of each other and see what's happening. We learned a lot from this crisis in terms of getting very close to our people, in terms of having them using a bottom to top approach in terms of leading them. We are their, we happen to be their leaders, but we also have to take into consideration while we provide leadership for them, we have to be cognizant that their perspective matters in the decisions we make. Because a solution that we may be looking for could be with them, and they could be able to help you find that solution. So in short, I'm trying to say to you that we have a pivotal role to play. We have a cardinal role to play. And I think under the Covenant of Mayor, we think that can be achieved with a collective support for each other.
Another excellent intervention there from our Honourable Mayor from Monrovia. I've also noticed that there are a number of questions and messages of goodwill coming in on the chat, and we really are delighted to see so much interactivity between all of our fellows here on the continent. And we are noting each one of the questions, particularly for the Q&A session that will follow this last intervention, but also we will do our best to respond to all of the questions raised and send the questions and answers through when we do send the recording of this webinar. So to move on to our final intervention from Mr. Mohamed Diop from Dakar in Senegal. He's the director of CEFAL, and he has been doing some great work there in the west of Africa and Senegal, and he's speaking a bit more to the current situation and the lessons that have been learned in West Africa.
Les collectivités territoriales sont une interface importante entre le secteur public et les communautés, particulièrement face à une crise de l'ampleur du Covid-19. Quelles sont, selon vous, les meilleures pratiques locales que vous souhaitez partager avec d'autres collectivités?
Merci, M. Gabriel, tout d'abord pour vous féliciter et vous magnifier cette occasion que vous nous offrez, nous, en tant qu'acteurs locaux, pour participer à notre expérience par rapport à cette pandémie qui a secoué la planète et qui continue de le faire d'ailleurs. Donc, pour répondre à votre question, je dois dire que
local governments had and still have this role of managing grassroots communities. This is the goal of decentralization. Decentralization is about allowing the government to, through other channels than deconcentration, to reach out to as many people as possible. And I think this is the reason why local governments and municipalities have understood this, and they took on this role, this responsibility to manage as closely as possible their populations and to really take on their basic needs. This crisis is impacting almost all of these aspects. We're talking about health, we're looking at hygiene, looking at contamination, and I believe that this is something that has been understood, and the current practices that we have implemented in Senegal, unlike other countries, because let me remind you then, looking at past crises, luckily we were never confronted to the Ebola crisis or other crises of this nature. But despite this, we have tried as much as possible to look at what was going on in other countries in order to anticipate and contain these pandemics. As we speak, we have less than 3,500 cases. And today, on Friday, we had our 40th death. But this gives you an idea. Of course, it's a tragedy, but if you compare to what's going on elsewhere, I think somehow we're lucky. And the city of Dakar, since the emergence of this pandemic, has tried to play its role as capital city. Beyond its position, has the highest number of cases in Senegal. Out of all the cases in Senegal, 76 have emerged in Dakar. So this is just to give you an idea of the number of cases that we have in the capital city. And as capital city, we have more resources than other countries. Therefore, we know that we have a pivotal role to play, and we need to support the government. And we actually granted 100 million CFA francs to the government, which amounts to 150,000 euros. We supported the government in different areas of expertise. As you know, health is an area of expertise in Senegal that is managed by local governments. And this is something that the city has understood very early on. Looking at the health map of the city, only the 4 university hospitals that haven't been designed or built by the city. Otherwise, all the different health infrastructures, maternity wards, etc., have been built by the city, and the staff working there is city staff. And with phase 3 of decentralization, which led to the universal communalization, with commune d'arrondissement becoming commune de plein exercice, these health sites, health infrastructures have become the responsibility of local communities. In the past, it was the city's responsibility. The city has even created a geriatric center. It's the only geriatric center in Senegal, aside, of course, from the Institut de Prévoyance Retraite. So, and the most vulnerable people right now are the elderly people. So when the city is already equipped with a center to take care of them, it has a huge impact on protecting these vulnerable people and the care given to these people. Aside from that, almost all schools were disinfected, markets were disinfected, bus terminals, which fall under the umbrella of local governments, they were sanitized, disinfected. In Africa, as you may know, public transportation is very problematic. And again, cities stepped in order to make sure that social distanciation was enforced, but also to make sure that the people working in these sites, on these sites, be equipped in order to protect themselves from this disease with hand sanitizers. And just yesterday, we donated high schools and primary schools. We donated hand sanitizers, etc., to schools because Senegal has decided to reopen schools for students and pupils who had an exam this year in order to avoid a lost year. And Senegal has given each and every student 3 washable masks, but also to teachers. And Senegal has given 4 head thermometers, washable trays, and disinfecting products. Aside from the disinfection that we've carried out, 150 volunteers were mobilized and sent to different schools and churches to make sure that school could reconvene, all the while enforcing the different social distanciation measures. We have given an ambulance to each academy. We have 4 to make sure that our students and pupils can take their exam and then proceed to the next grade as peacefully and as safely as possible. This is our experience. And despite the fact that the city has never experienced a pandemic before, we've done everything we could in order to prevent the spread of the disease. We have donated almost 1 billion CFA francs to our population with the ambulance, with the equipment, etc. This is just to show you how pivotal the role of the city of Dakar was and is. We are already seeing the results of these efforts to contain the pandemics. Because despite the growing number of cases everywhere, we have been able to contain the pandemics. In some countries, we're seeing thousands of deaths. We have 40 deaths right now in the country. This is something that we need to take into account. And we need to enforce these measures as much as possible in order to contain these pandemics. Thank you. Listening to you, it sounds like the city has a pivotal role to play in the resilience of populations. As director of CIFAL in Dakar, what are the main what is the main piece of advice that you'd like to give to build sustainable and resilient cities? I think this really is the heart of the debate. It's central to the debate because we have imported models that were not African in cities. Looking at Dakar, for instance, we're living in 75 square meter apartments, while in the past, African people used to live in large spaces and not in apartment buildings above one another. And this is an issue. I think we need to rethink our habitat. We, of course, need to open up, but we need to remain grounded. We have our methods, our way of life, and it has nothing to do with the cities that we have now and that we live in. In our cities, there's no plants, there's no agriculture anymore. Imagine if this situation was to last. People would be confronted to famine because we can't import or export food. Everywhere across the world, people now want to be able to manage their stocks in terms of drugs, in terms of food, cereals, etc. So if cities were designed in a way so as to, even if this pandemic was to last long, to be able to feed themselves, to move the way that public space is managed, we're clearly seeing that some hospitals don't have the capacity to treat some people. We need to open up stadiums, etc. So I think we need to rethink the way that we designed our cities. We need modern cities where people like to live, where it's nice to live, but at the same time, we need cities that embrace our traditional values of civilization. We need more space. And looking at lockdown, people who are living in 350 square meters apartment houses don't have the same difficulties than the ones who live in a 75 square meter apartment. I mean, take the example of domestic violence, for instance. So I do think that we need to create and design cities based on our beliefs, on the traditional values of our civilizations as countries. Thank you. This year we saw how an unprecedented crisis can change drastically a local and global situation, forcing cities to come up with innovative ideas. How can cities prepare to the future and to the challenges of the future? Well, I think we need to adapt, and I think that we need to find innovative ideas and solutions. We need for that to create smart cities. Here we are in a webinar, miles and miles away, and at the same time we're getting the same result as if we were in the same room. People can work from home now. Pupils, teachers can follow a course from the comfort of their home. People can work from home remotely, and they're just as efficient. And I think the world has changed. We need to use the digital means, tools that we have, Wi-Fi, digital tools, in order to reduce some risks and to facilitate, because these are all facilitators. In the past, everyone wanted to be present. Well, now we know that someone can stay at home, work, and get the same results than someone who goes to the place of work every day, sometimes more efficient because you're not stuck in traffic in the morning and the evening, etc. So this is something that we'll have to rethink. What matters is to be effective, to have clear objectives, and we need to move towards these smart cities, these methods, these cities where people can really do a lot without leaving their homes. And I really believe that this will also allow us to mitigate climate change, pollution, etc. Because when people are staying home right now, there's no transportation. So a lot of this energy can be harnessed for other things than just efforts that can be bypassed and still get the same result. Talking about connection, according to you, what is the added value of networks such as the Covenant of Mayors in Sub-Saharan Africa in such a crisis? Well, I think that we are a network and we are there to share our knowledge. We have a network to share practices. This network is in a way a way to benchmark. We can learn from one another. You heard it. If the city of Dakar or if the state of Senegal was able to contain this pandemics and not reach the levels that we're seeing in other countries, it's probably because we really tapped into what other countries had done, and also in other and past pandemics, including Ebola. So I think that from this network, we are expecting solidarity and experience and knowledge sharing amongst cities. And I think that this network, the network of mayors, is perfectly relevant in these pandemics to share our experience and our practices. We have seen incredible results already. And I think we should rely on this network, but also in terms of donations, we need to support health facilities. We are part of this network in order to learn. We are part of this network to show solidarity as well, and to cushion any blow, and to mitigate risks through this sharing of experience, which is the goal of networks. Mr. Diop, you seem to think that solidarity is essential. Would you like to convey a message of solidarity to other cities? Well, the message of solidarity that I would like to give you is the following. Through this pandemics, we were able to observe that borders are pointless. We're talking about imported cases, and clearly what matters is for local governments everywhere to work hand in hand. Each local government, based on its specificities, based on its core activities and its potential, should help other local governments and local communities that need help. And the same applies to the state. I tend to say that if cities and countries had right away supported China in order to fight COVID-19 right from the start, instead of just staying at home and trying to protect their fellow citizens, we wouldn't be in the situation that we're in right now. So I'm not trying to stigmatize anyone. We shouldn't stigmatize anyone right now. We should simply team up against this disease, which is spreading in air, land, and sea. And we cannot contain this disease with our own arms and hands. So if we don't have this sharing of experiences and discoveries, by the way, I really appreciated the Malagasy approach with Artemisia, even if it was disputed. I think it was a great gesture of solidarity. It really showed that when they thought they had discovered something that could put an end to this disease, they wanted to share it. They thought they had a breakthrough and they wanted to share it with all the local governments in the area. And it was great. We've seen also great gestures of solidarity with doctors, Cuban doctors that went to Italy, etc. We're seeing this solidarity everywhere. And I think that this solidarity is essential. We should work hand in hand. And if we're seeing more solidarity in terms of research, this is how we will win. We can't have anyone monopolize the progress made.
There are some really pertinent questions that have come through on the chat, and I'm really interested to hear their responses from the panelists. So please, if you are able to, please do stay with us while we switch over to our panelists. I'm just checking. I know that our Honourable Mayor Koji from Monrovia was unable to connect a bit earlier, but I'm just checking if he's managed to connect now. It doesn't seem to be the case. In that case, I will just turn over a question for Mr. Diop. What were the challenges, and this came from Tulani Kuzwayo, what were the challenges in the cooperation between different levels of government that make the COVID-19 response difficult? And how can it be changed?
Bonjour tout le monde. Donc, je voudrais manifester toute ma joie pour participer à cette intervention, pour véritablement remercier ICLEI pour nous avoir permis de participer à cet webinaire en présence d'éminentes personnalités, à savoir le maire de Monrovia et le maire de Kampala. Je pense que les principaux défis qui aujourd'hui posent problème au niveau des collectivités territoriales à l'administration centrale, c'est la communication. Donc, il faudra faire en sorte que, excusez-moi, donc elle a pu...
No, not at all. Hi there.
Voilà, donc... Donc, c'est le confinement qui est à l'origine de tout ça. Donc, on a beaucoup de difficultés pour je pense que la réponse est venue d'elle-même. Donc, tout ça, c'est la communication, comment gérer nos enfants, etc. Donc, comment les contenir. Je pense que la chance que nous avons, nous, au niveau de la ville de Dakar, c'est de disposer d'une radio. Donc, tout disposer d'une radio municipale qui nous a beaucoup permis de communiquer. Tout à l'heure, le maire l'a dit, que dans d'autres villes africaines, le problème de langue se pose. Nous, au Sénégal, nous avons une langue nationale, le Wolof, qui est pratiquement parlée par 95%, voire même 96% de la population. Et donc, c'est ce créneau-là qu'on a utilisé pour communiquer, pour pratiquement permettre à tout un chacun, malgré le niveau d'analphabétisme très élevé, pour que les gens puissent en tout cas connaître ce qu'il faut pour réussir ce qu'on a réussi, entre guillemets, jusqu'à présent n'ont pas atteint une situation ingérable. Je pense qu'aujourd'hui, le véritable défi se situe à ce niveau. On a aussi noté beaucoup de lacunes au niveau de la communication institutionnelle. Et donc là aussi, c'est un véritable problème. Il faut dire la vérité, il faut dire véritablement communiquer vrai. Qu'est-ce qu'il y a lieu de faire, qu'est-ce qu'il ne pas faire, etc. Donner la bonne information. Aujourd'hui, c'est ce que nous connaissons. C'est ce problème-là que nous connaissons. Il y a certaines personnes qui ne croient même plus à la maladie, tout simplement parce qu'il y a beaucoup de tergiversations, etc. Donc, je pense que c'est le véritable défi. Donc, je m'excuse. Donc, il faut que attendez, je m'excuse un peu.
Not a problem at all. I think we're all, it's all good that it's nice that we all get to know each other on another level now, that we're all sort of home. So it's great to see our youngest attendee on this webinar. Thank you, Mr. Diop. I see that our Honourable Mayor Koji has managed to join us, which is great. I think there's a question that is quite relevant for the Monrovia case, and this came from Le Jaquel Bilao Ananda, I think. Excuse me for my pronunciation. And the question is, thank you for sharing your experience. I would like to know what has been the impact of your actions, what needs to be improved, and what do the people think?
Well, thank you so much. I I think that is a brilliant questions that are being asked. What have been our impact and what have been the challenges that we have encountered, if I got you quite right? Is that the question?
Exactly, yeah. So the question is all about, yeah, what have the impact of your actions been? And also if we can think, what are some of the challenges, and also what do you think, you're going to want to improve in the future as we grow from this?
Yeah, okay. Firstly, we were able to captivate a cross-section of young people participation to what you call a service to duty. Like I said to you, there was a very strange pandemic, not just only unique to Liberia, but unique to the whole world. Everybody didn't know how to tackle and what to do. So we were able to talk a population of 1.7 million people with 400,000 of that exactly population that reside in slum community. So we were able to talk to 8,500 young people across the city, getting them involved into massive awareness and mobilization. Some of them they were demarcated into active case funding, sensitizing our people. So the first benefit that is that we're able to have this huge group of young people getting interested in standing up and rushing into the defense of the country. And then the other aspect, we were able to see the statistic about what is happening now in our country, that the virus were not able to overwhelm our country because of our previous experience of the Ebola and our own willingness about the young people. Take, for example, what has happened. The data that we have formulated, new approach behavioral change for a sustained approach to the post-COVID-19 recovery plan. The city government is now gathering data on the hands watching habit and has realized a phenomenal change from 1% to over 88%, that we realize that 88% of our population have gotten consistent watching their hands. That was a huge, huge improvement over. We went out of 397, a 200 household mark. All of those persons were able to have 397,000 household mark. All of that, the young people were able to speak to 794,400 persons were spoken to. 794,400 persons were spoken to, particularly about informing them about the deadly disease. Then we were able, normally we ensured that the city informed that every household should have a bucket. We're able to distribute and deploy 344,000 plus buckets were distributed in and around the city. That brought into conclusion 88% of our population were adherent to hand watching. So I think that was a significant, change, improvement. One of our challenges we have, knowing that we are African people, we very used to, being very intimate with our people. Our culture is getting together. The social distancing was a serious challenge for us. Our people could not understand what it meant about encouraging them to engage into social distancing. That was, in fact, as I speak to you currently, it still remains a fundamental challenge as we continue to fight the COVID-19, because like the president issued on that, we have a state of emergency. We have from 3 o'clock to 6 o'clock. Now the president has extended from 6 to 6. But yet and still, we still cut serious distances. You go to the marketplaces, you go to public area, the people still could not see a fate to distance themselves. But they were able to listen to us. They wore their masks. We were able to tell them about the mask wearing. As I speak to you now currently, the city have encouraged a lot more of its residents to the wearing of masks. What we're trying to do is that we're trying to talk to them so that they can be able to adhere to the social distancing. So basically, those were our challenge in it. And secondly, technology. You know, there's a third world country, we have a huge, if we're gonna have technology, we didn't have to deploy that kind of amount of people. All people have to go literally from whom to whom on numerous occasions, trying to get to people, trying to get in contact with people, trying to inform people. And now basically what we have done, we're also encouraging our people to get tested. We're encouraging our people so they can be able to get to understand their health status. So, and now, like I said to you the last time, we have an active call center. That call center has been very effective to us because it is a place that we can be able to get in touch with our people immediately. We have the number running. When there is a situation in the community, when our young people, volunteers are in the community, when they encounter any hostility or something, it is where they can be able to reach out. So we have a very wonderful experience. And that what we're trying to do now is like I said to you, we're trying to reinforce our network. And that network got to be directly with the people. So in case of any future pandemic, we can be able to respond to it quite more decisively, or in a more robust manner than where we are. But it still remains a challenge for us in terms of our economic. Everything has taken a downtrend. Things have changed. The economic still, in terms of the city, it remains still a challenge of us. So basically, those are our experiences that we were able to encounter while in the fight against this COVID-19.
Great, thank you so much, Honourable Mayor. Yeah, I agree. You know, and we can see from what the mayors are doing across the continent, some great work, really working with communities, working with youth, working with vulnerable groups to ensure that we all get through this pandemic together. Maybe then in closing, I'd like to reach out. Our good friend and colleague is also on the call, Mr. Vincent Kitio, and he posed a question earlier to the mayor of Kampala, but I think it is also a question that is relevant to each of the cities that are represented here on this webinar. So I'd like to pose it to all of you to consider potentially as your closing remarks for this webinar. But the question was, the post-COVID-19 response, what is the plan of the municipality to address the informal settlements in cities in an effort to improve and address health crises? So really thinking, you know, after this pandemic, how are municipalities going to address the issue of informal settlements in cities? And you know, from the work that we've also been seeing on the continent, it's also about embracing the informality. But how are we going to work with these informal settlements to improve and address health crises? So maybe if I can, since you're already unmuted, Honourable Mayor Koigi, to respond to that, just some final remarks from you.
Okay, well, thank you. I think again, that is a very brilliant question. I think we policy leader must begin to start thinking about how we can incorporate our engagement with the informal sector of our respective city. Like I shared with you earlier in my engagement, like I'm just on the field. I came running to see how they have given me a direct interaction with the people. Through the COVID-19, what is true, I've been engaged with them, but I mean, they have improved my relationship with them. I get into the community. I get to understand their situation. And I can go every evening from Friday to Saturday to Sunday. I get to the community, some of those vulnerable kids. We provide hot meal for them. We engage them. And we understand that it's frankly appropriate that we must begin to understand the people that we are working towards solving their issues. And the way we can do that is to begin to hear them out, is to begin to engage them directly. Sometimes, like I said to you, we think that we sit in our offices and we form solutions for those people. It may interest you to know that when you engage the people, you get to realize that some of the solutions you think you could be looking for could be with them. Because they understand, like I said, when we just started this fight, the people participation, when I hit the community and they said to me, we can be our mayor. Can you create an opportunity for us to be able to assist you in this fight? And I said, what do you mean? And they said, look, what we want is that we want to be volunteer. It was our engagement with them. And I want to say to you, because we got them involved directly, every community, they demarcated their various districts into zones, into a way that they themselves was asking the community dwellers, before you enter in the community, you must adhere to the various health protocols. And that measures became very much effective rather than the city government trying to go into the community. Community dwellers themselves were taking the charge. They were leading the charge in ensuring that the health protocol that were being released by our health administrator were being instituted by the community leaders themselves. So I said to you, it is very important that after we collectively can be able to get COVID-19 out of Africa and the world particularly, we now need to maintain those channels of engagement with our people, those formal engagements. So we begin to cultivate some of the expertise that we have encountered while dealing with them. So I cannot agree with him more, but to say to him that yes, indeed, the informal sector have a cardinal role to play in our engagement. Like I said, I want to say thank you so much. We have learned a lot, and we're trying to compile all of our experiences, all of our challenges, and we'd like to use this platform. We'll be able to share an official report with you with our view, our encounter, our experiences, and so that we can, our friends in other cities can be able to see our own approach, and we will also be humble and we'll be glad to be able to share their experiences and see how we can be able to, harness some of those things into our own collective good.
Great. Thank you once again, Honourable Mayor. It was really a pleasure to have you on this webinar, and I think I can speak from others that have joined. It's really great to hear the experience from Monrovia, and I think every one of us has learned a lot also from your experience there. So maybe now over to the Honourable Miss Namazi, if you have any closing remarks from Kampala, from Uganda.
Thank you so much. Thank you, Tara. I want to thank the Honorable Mayors and all the people that have tuned into this webinar. Maybe my final remarks, I want to thank you, Tara, for moderating this meeting very well. I want to thank all the African cities that have really made an effort in fighting COVID-19. However, I want to remind all of us that let us not concentrate only on COVID-19, but there are very many factors that are coming on board as COVID-19, especially the health issues. So we should also look at other health issues, other political issues, legal issues that are affecting COVID-19. Back to your question that you gave us of how we hope to tackle the issue of informal settlements in our cities. First of all, this COVID-19 situation has given us an opportunity to look at our cities effectively and efficiently, because now we've been in a lockdown as Kampala capital city, and we've been able to look at the city without people in the city, without vehicles in the city. So we've had serious aerial photographs of the city. So this is going to really help us as we set up our structure plan of the city. When we have a structure plan and we can be able to follow it effectively and efficiently, that will also help us to be able to deal with the issues of informal settlements, because then probably if we get funds, we can be able to construct for these people formal housings where they can be able to stay. Then also, I think it is important to be able to stimulate the economy in our cities, because right now people are sitting at home, most of them are not working, most of them have eaten their capital and have nothing to start with. So I think as cities we need to look at stimulus packages where we can help our city dwellers, because it is only when we help them, when we improve their standards of living, that they can get out of those informal settlements. If we fail to do that, we can do whatever that we are doing, but they will not get out of their informal settlements because they are not economically emancipated. So it is very important as cities to think about the economy of our people. And this issue of informal settlements, it is political, it is legal, it is environmental, it is economical, and it is social, all those aspects that we need to sit down as leaders in the city to make sure that at least by then we can, after this COVID, post-COVID, we can be able to deal with all those matters, and also help our city dwellers to have better lives. Thank you, Tara.
Great, thank you so much, Ms. Namazi. And over to Mr. Diop from Dakar, your final words.
Voilà, merci Tara. Donc, moi, je vais conclure en abordant dans le même sens que les éminentes personnalités qui m'ont précédé, en magnifiant cette opportunité que vous nous offrez et vous remercier pour cette belle modération. Remercier aussi M. Damien Gabriel pour sa participation et tout ce qu'il a fait pour la réussite de ce webinaire. Donc, moi, je pense que ce qui m'a le plus, en tout cas, interpellé par rapport à cette situation mondiale, c'est la notion d'essentiel. À chaque fois, les gens reviennent sur ce qui est essentiel. Qu'est-ce qui est essentiel? Qu'est-ce qui n'est pas? Qu'est-ce qui est accessoire? Qu'est-ce qui est secondaire? Qu'est-ce qui est vital? Je pense qu'aujourd'hui, les collectivités territoriales doivent, en tout cas, se pencher sur ça. Où est-ce qu'ils doivent mettre la priorité, quelles sont les dépenses de prestige, etc. Donc, parce qu'aujourd'hui, nous connaissons pas mal de difficultés, tout simplement parce que les gens ne sont pas accordés sur ce qui est essentiel. Et c'est là où la démocratie participative prend son sens. Il faut
essential, and this is what democracy is about. We should really be able to have inclusive projects where everyone has a say. In Senegal, I said it earlier, Dakar has really early on taken on this area of expertise that is health, except for university hospitals. Everything, all the different health infrastructures and facilities belong to the city. So cities need to invest in health. And we should make sure that there's a relationship between the health infrastructure and the urban planning. It's necessary. This notion of necessity is crucial. We need to make sure that people have access to the basic services, health, environment, education. There are a lot of challenges that we are aware of. And we need to better assess them to know what are the new paradigms that we will have to deal with in the future. And we will need to learn and capitalize on best practices. depending on the specificities of each city in order to find together a solution that will allow us to prevent any such crisis from happening again, or at least anticipate and contain them as quickly as possible. Thank you.
Questions that we unfortunately haven't had time to address during this webinar, but I must thank everyone for really the great interaction. We also acknowledge that the mayor, minister, and also our esteemed guest from Senegal have all stayed quite a bit over time. So really thank you for that, and thank you for also humoring us with responding to questions way after we were scheduled to end the webinar. So our sincere thanks for that. And to everyone who participated, apologies once again that we didn't get to all of the questions, but we would like to ask you to please join for our next webinar, which is going to take place on the 17th of June. And it's going to be on the topic of effective communication. And we'll be sure, as I had said earlier, to respond to the questions that we haven't unfortunately been able to respond to during this webinar when we do send the recording for this webinar. If you weren't able to join for the entire webinar, or you potentially only were managed to connect for only a bit of the webinar, this will be recorded and available on YouTube. We will send the link to you, so please feel free to watch it on YouTube and raise any questions there. And we will do our best to also respond to any questions that you or any of your colleagues might have after the fact. So maybe just in closing from my side, just a few key notes that I sort of jotted down through the course of this webinar. It's very apparent that mayors are at the forefront of this, and will be in the forefront of all other future crises, as the important interface between the public sector and also the communities. The solidarity is key, as we, through the Covenant of Mayors and Sub-Saharan Africa network, will continue to collectively work together through this. We will also continue to support you in developing and building this community of practice to ensure that these key messages and lessons are shared amongst signatories under the COMESA. And local governments also need to deal with their day-to-day mandates, as well as other crises that might hit all at once. So the importance of making sure that there is enough saved for disaster risk management is definitely key, and key to think about going into the future, as it is cross-cutting through all departments and sectors of a city. And it's necessary for us to make sure that there is adequate funding and financing available at the city level to ensure that we can deal with these crises. So just some of these will also be tackled throughout the webinar series, also as we focus more on finance in an upcoming webinar. We also have a webinar that will focus on climate change and resilience, and how as a city to continue to plan for what's coming in light of climate change. And also a webinar focused more on access to sustainable energy, as it also a key issue that's been raised by a number of our signatories. So we do hope that you will join us for the rest of the webinar series. Thanks again to our esteemed guests, and thanks again to all of our participants. And we hope to see you on the 17th of June for the next webinar. Thank you, and I wish you a good day. Goodbye.